So I'm happy to be back to be presenting this topic today. What is the integrative East-West model? And today I'll be talking about the practical guide to East-West self-care. Just to kind of give you a little overview. So right now I'm a fellow at the UCLA Center for East-West Medicine. And I'm also leading a project that is between UCLA and Tzu Chi Medical Foundation and the EastWest project. So my role is really try to bring what I learned at UCLA about East-West medicine and bring it to the Tzu Chi Medical Foundation so we can utilize all the benefits of East-West medicine. And today I'll be talking just shortly what we do at the clinic to give you a basic overview and also some practical approaches that you can utilize in your daily life to help improve your health and your well-being. So the UCLA Center for East-West Medicine, our main mission is to improve the health and quality of life by bringing together the best of Western and Chinese healing traditions to provide healthcare that is safe, effective, affordable, and accessible for people, families, and communities. And you'll hear that a lot by the founder of the center, Dr. Takehome, who's in the picture in the center. And currently, the UCLA health system, there are 4 clinics all over. The main clinic is Santa Monica, and the other clinics are Torrance, Palo Verdes, Westlake Village. And recently, a couple of years ago, they started an inpatient program at the Santa Monica Hospital, where patients who are hospitalized for any specific reasons are able to consult the East-West team to do acupuncture and different treatments to help them while they're in the hospital. And this is Dr. Takehome, who's the founder of the Center for East-West Medicine. This is his son, and all the other ones are the attending physicians of the different clinics at the different sites. Just a little overview about CEWM. We have 13 board-certified physicians who are trained in East-West Medicine. We also work in conjunction with 13 licensed acupuncturists who are also trained in East-West Medicine. And the patients that we get are referrals within the UCLA health system. And there are over about 500 specialists, varying from GI specialists, pain specialists, anesthesia, rheumatologists, or in PCPs that refer patients to us. And we get about 30,000 visits each year. So it's quite a bit of visits. And a lot of the patient population that we see come to us sort of as last resort. Because of conventional Western medicine, they've gone through the system, they've seen different specialists, they had different testings done, they have multiple procedures or medications, but there's a disease or condition is not improving. And a lot of times, some of these conditions are involving a lot of pain issues, but we also see other conditions not involving pain as well. So when we see them, sometimes they're very exhausted, but we're also able to help them in the long run because we use the East-West approach. That's focused on non-drug therapies. So the definition of integrative medicine, you probably heard about it. It's been a very popular thing and trending for the last 5 to 10 years. Specifically, integrative medicine looks at the patient from patient-centered care, more individualized. So, from a Western approach is mostly they want to standardize everything where everyone gets the same medication, the same treatment. But integrative medicine looks at everyone as an individual. It's a holistic approach. So we're all very different because our biochemistries are different, our genetics are different, our lifestyles are different. So each one of us have different responses to treatment. So that's sort of the integrative approach. And also it uses many different therapeutic modalities with a focus on non-drug approaches. We want to focus on non-pharmacologic approaches instead of adding more medications to help patients. And through the integrative approach, the main purpose is really to activate your own body's ability to heal. And we do that through self-care tools, acupuncture, cupping, and different modalities at the clinic. And it's also backed by evidence because a lot of people who don't believe integrative medicine says it's not a lot of evidence behind it, but Dr. Liu will talk a little bit later about there is evidence behind acupuncture and there's more building up a lot of research behind it. So this is kind of an overview at the Center for EastWest Medicine, the clinical model. So like I was talking about, we get referrals from the specialist. And when they come in, we really do an assessment from both sides. They usually come in with a lot of Western diagnoses like lupus, fibromyalgia, or chronic pain, neck pain, low back pain. And then we kind of get an overall diagnosis, what they've been treated with and what medications they've been on and what has not worked for them. And then during our assessment, we asked about questions that's related to the Chinese medicine diagnostic approach. And then we assess them based on the East-West diagnosis. And after that, we mainly focus on three components. The first one, people coming in, a lot of them are having a lot of pain for a long time. We do Chinese medicine treatments like acupuncture. We also do a Western modality called trigger point injections. And the purpose of this is try to reduce how many medications they're taking to decrease their consumption. And at the same time, we provide a lot of education about their nutrition. We teach them acupressure points if necessary and how to manage their stress. And then overall, the self-care is a major component of our care. So we're not just an acupuncture clinic. So a lot of the private acupuncture clinics that you see outside, you go in, you get acupuncture, and you go home. They don't really address some of the other issues, as part of your lifestyle that's really affecting your health. So that's sort of the holistic, patient-centered approach to the care. So just to talk a little bit about the whole person approach. So when they come in, we assess their prior conventional workups and what treatments they've gone through. We talk a lot about their health history, but a lot of the stuff is including their social history. If their childhood was happy, if anything happened when they're during their childhood. We talk about patients' work, any psychosocial trauma. We talk about nutrition, their lifestyle, to see what things we can improve on. Because health is not just about one thing. It's many things put together that makes you a healthy person. And then we also use conventional, where we do a physical exam, supplemented by the Chinese medicine diagnosis, such as we palpate their acupuncture points to see what are tender, and we also use tongue diagnosis as part of the diagnostic pathway. And this is just a little brief background about traditional Chinese medicine. As you guys already know, it's been around for over 2,000 years. It's a very comprehensive system based on very deep theory, has its own diagnostic system and lots of practices and modalities that it use to treat patients. And some of these modalities include acupuncture, which is very popular now these days. Everyone heard of it, and most people have had experience with acupuncture. Chinese herbal medicine, moxibustion, which is burning of the herb. Tui Na, which is also meaning Chinese massage. There's also acupressure, which is massage on the acupuncture points, dietary therapy, and the practice of Qigong or Tai Chi. So Chinese medicine, the purpose of it is really to restore balance and flow of the body, because the main goal of Chinese medicine is to provide balance. And it's very, very individualized, like I said before, because every one of us is very different. We all have our own different constitutions and different body types, per se. And through the Chinese medicine modalities, you want to focus on enhancing the body's its own ability to basically build up resistance, where you boost your qi, per se, to build up your homeostatic reserve so you can prevent your body from getting sick. And it's less emphasis on the specific factors, which is more of a Western approach. They always want to find a specific cause for one thing. But most of the times, it's very difficult to do because not one thing can cause disease. Most diseases are caused by a variety of factors that come together to cause symptoms. So the balance of Chinese medicine is based on Yin Yang Theory. So you probably all seen this Yin and Yang symbol. So there are two extremes brought together, but they're in perfect balance with each other. As you can see, anywhere you cut the Yin Yang symbol, it's always equal on both sides. So to relate sort of Yang and Yin to the Western analogy, so Yang will kind of represent the sympathetic nervous system, which is the fight or flight system that you learn about in science class. It's the fight or flight where you're running away from a tiger. And that's the sort of represents the yang side. The yin side is the parasympathetic nervous system, also known as the rest and digest phase, which is the calming and the rest part of the nervous system. And I'll describe why these two principles are very important when it comes to self-care. So here's some examples of yin and yang and characteristics. As you know, so in part of nature, yin and yang, they're kind of opposites. So yin mostly means night, the moon. Yang is sun and during the day. And yin are more of a passive, the rest phase, and yang is more active. And here's some more examples below that. And in people, yin is more woman characteristics. It's not really about the sex, it's just the characteristics and man. And there's different parts of the body. Some parts in front means the yin side of the body. The back of the body means yang. And this is all very related to everything in our organs and how everything functions inside our body. And in medicine, there's also yin yang too. You know, there's also cold and hot, and different things about your metabolism. You can just see all these things are kind of the opposites of each other, but they always have to be in balance to maintain health. And also in food, there's yin yang principles too behind food nature qualities as well. So you guys all heard of qi before. So qi, there's lots of definitions for qi. Some people call it the vital energy. It's invisible. You can't see it. So qi travels along the meridians along the body. So we have this highway of meridians that goes inside the internal organs that comes out and travels from your head to your chest to your toes. And through the meridians, qi travels. So some people say it's called the life force, but in Western analogy, some people have called it the ATP, which is the single unit of energy, if you learned in science class. So also it's interesting, if you look at the qi symbol, the bottom of qi means rice. So when you eat food, rice, because that's a Chinese culture, you get qi. So qi comes from different forms as well, not just from the air you breathe. You get qi from the food that you eat, the air you breathe, and also the qi from the environment as well. And the functions of qi really is to protect your body from pathogens, so from viruses, diseases. So when your qi is full and replenished, your tendency to get sick becomes less. And also when you have qi in the body, it transforms the food that you eat into nutrients so your body can absorb to provide you nutrition. And qi, also when you have qi flows through the body adequately, it also helps your blood flow. So what is the relationship between qi and medicine? So qi, without qi, there's no life. So when you die, qi stops flowing. So the Chinese medicine really is focusing on the study and the maintenance of qi. So the quantity, so the amount of qi you have in the body, and also even with enough qi, you need to have normal flow of qi through the body to prevent diseases. So when you have inadequacy of qi, so qi deficiency, you can have disease. And when you have blockage of qi or qi stagnation, it can also cause disease too. So they go hand in hand with each other. So what happens when qi stops flowing? So we call this qi stagnation, and it can affect various parts of the body. So when you have decrease in blood flow because qi is not flowing, it can cause clots, plaques, like cardiovascular disease. You can have poor circulation, and also can cause pain. So when qi is not flowing, just imagine things are not flowing through, you get stuck. So when something is stuck, it creates pain. From the digestive system, you can get a lot of symptoms like bloating, gas, constipation, acid reflux. When it comes to the lungs, if your qi is not flowing in your lungs, you can get shortness of breath, wheezing, you get spasms, like in asthma. And in females, you can have menstrual issues like irregular menses, you can have cramps, irritability, before menstrual cycles. The urinary system, you can have urinary frequency, urgency, or incontinence. And also, when qi doesn't flow, it can cause a lot of muscle tension. And we see this a lot in clinic. Most of us are under a lot of stress, especially with COVID-19 lately. When people are stressed, our muscle tend to tense up because qi doesn't flow under stress. So how do we optimize your health? So we really address the 4 pillars of health and well-being at each visits. We see patients. And the 4 things we really focus on is, number 1, reducing the amount of stress you're undergoing every day, how to getting better sleep, how to eat better, and how to do the right forms of exercise for yourself. Because there's so many forms of exercises out there and not all are created equal. And some people's body type may not, can stand like weightlifting or doing high intensity exercise. So we look at everyone's body type when they come in, their constitution in Chinese medicine, and determine what type of exercise is good for them to do. And lastly, we talk about with patients, they have healthy relationships, in their social life, and also they're doing something in their life and a career or hobby to have a sense of purpose. And I'll go into each of these things in detail, okay? So most of everyone these days have lots of stress. So the first thing that we really focus on is really giving tools to patients to proactively reduce their stress. Because like the sympathetic nervous system, the yang side of the yin yang symbol, it's always overactive. So your yin side is always very underactive. And when that happens, you have this imbalance for a long time. And this imbalance later on creates disease. So to try to actively reduce your stress, we'll try to rebalance the yin yang in your body to bring balance back. So a lot of things that we offer patients and we recommend to do, just do something every day to relax yourself. It could be taking a bath, getting a massage, meditation, going outside to nature for a hike or walking, listening to music. Also popular in Chinese culture is foot soaks. So these are just some methods that we kind of tell patients to do every day. You have to relax, because most of us are not relaxing on a daily basis, and this creates so much stress and just a vicious cycle. So number 2, I think I really focus on with patients is sleeping better. Most of us don't sleep enough, and also if you do sleep enough because of stress, we're not sleeping very well. We're not getting deep restorative sleep. So we want to focus on ways we can decrease your stress, decrease your tension in the body to help you sleep better. Based on the National Sleep Foundation, for adults between 25 to 64 years old, we really need 7 to 9 hours of sleep each night. And not just lay in bed for 7 to 9 hours, actually getting good, deep restorative sleep. And some of the ways you can help getting good sleep is your exposure to sunlight. So in this graph, it talks about a little bit of the intensity, the LUX of the daylight. That's how they measure how bright things are. So when you're outside in daylight in the sunlight, the lux is 10,000 units. But when you're inside the office, it's only 500. So you can kind of see the difference between the intensity of light. Because our brain, we have a circadian rhythm, and we need light exposure to really regulate that rhythm. But because of these days, we're a dark deprived society, meaning that we're mostly working inside office spaces. We're not going outside. We're not getting adequate sun exposure. We're getting lots of lights from electronics and blue light. And blue light, as you heard, is very detrimental because it stimulates your brain thinking that it's always morning. And we need this melatonin hormone to help you sleep. So also, we're also a light deprived society because we're also indoors all day. So some of the ways you can combat this is try to make a routine for yourself in the morning. You want to get some natural sunlight in the morning for 30 to 40 minutes. You can avoid wearing sunglasses to let the sunlight to penetrate into the eyes to re-regulate your circadian rhythm. You can eat your breakfast outside or enjoy your coffee outside to get some sun exposure. And then in the afternoon, you can wear sunglasses to kind of tell your brain, hey, it's getting dark, so it's time to secrete melatonin. So you need melatonin adequately enough in your body to help you get good, deep sleep. And then 1 hour to 2 hours before bedtime, turn off all the lights to about half to prepare your brain for sleep. And here are some common tips between East and West about sleep hygiene. So sleep is really about a regular schedule. You want to go to bed every day at the same time and wake up around the same time every day, even on the weekends. And from an East-West approach, bed is only really used for sleep and sex. You don't want to try to read in bed or watch TV in bed because it confuses your brain, if you're supposed to be sleeping or be up. And the most similarities, you want to go to bed by 10:30 asleep by 11 from a Chinese medicine point of view. And from a West point of view, you want to keep a daily routine like we talked about, awaken and sleep at the same time every day. And you can use different things like massage, acupressure points. You can do gentle Qigong or Tai Chi to help relax the body. You can also do warm foot soaks as well. And then from the Western point of view, just we talked about decreasing your electronic use around 7 to 8 p.m. So decrease the blue light exposure to your eyes, and just doing something to relax every day. And some gentle stretching is a good method to relax. Some other sleep tips to kind of help you get good sleep. You can do a little bit of aerobic activity, exercise about 10 minutes, like light walking or cycling can increase nighttime sleep quality. You don't want to do a very high intensity strenuous workout close to bedtime. So some of the good options are doing some Tai Chi or Qigong. If you do take naps during the day, you want to limit it to 30 minutes so you don't disrupt your sleep at night. And also you don't want to eat heavy foods before you go to bed because that can give you heartburn and can affect the quality of your sleep. And make sure that you're sleeping in a good, relaxing environment. You have a dark and cool environment to sleep. You can wear earplugs or white noise machine to help you fall asleep easier and stay asleep. So really just learning how to relax at the end of each day to help you sleep better. And number 3 on the 4 pillars of health is exercise. You want to move your body regularly. Most of us, are living a sedentary lifestyle. We binge watch TV, Netflix, Hulu, all these different things. We're not moving enough. It's really good to get up and just move around. And the current recommendation is that you want to do 25 minutes of vigorous exercise 3 times per week. Or if you don't do vigorous exercise, you can do 30 minutes of moderate exercise 5 times per week, depending on your schedule. And in the Western culture, exercise is a very popular thing, like the high intensity exercise, running, all these different things that is part of the Western culture. But sometimes when I see a lot of patients, people who are very athletic, that likes to move, they tend to overdo things. So do what you love to do, but always keep that balance in mind. Don't overdo it, because when you overdo things, you deplete your qi, you deplete your yin in the body. And later on, you can basically, it's like a bank account. When you do too much of things, you over withdraw every day. And that when you creates problem because your body's imbalanced. And some other forms of exercise is more of a mind and body exercise. And we do recommend a lot of patients to try this, especially Tai Chi and Qigong. There's a lot of YouTube links that you can try Qigong and Tai Chi, even yoga. Yoga, there's different forms of yoga. There's more high intensity, there's restorative yoga. And usually when people are depleted, when they're tired, we try to focus on restorative yoga. And swimming is good, light walking is also good, because all these exercises are more restorative. It doesn't deplete qi further from the body. And the last thing on the 4 pillars of wealth is eating well. Unfortunately, the standard American diet, which stands sad, in a way, consists of a lot of highly inflammatory foods, lots of caffeine every day, energy drinks and snacks, lots of fried foods with fats. All these are examples of things that's kind of very common out there with fast foods. Everything has been processed, packaged, and prepared. So these things over time causes a lot of inflammation in the body. And some of these foods you can eat, but you want to eat in moderation. We'll limit as much as you can if you already have a lot of issues with your health, such as dairy products and just refined sugar. So lots of processed foods has lots of sugar, and sugar causes inflammation in the body. And from a TCM point of view, we want to limit cold temperature foods, such as like icy beverages. We're also cold nature foods like salads or raw foods, and also alcohol and eating lots of spicy foods. Too much is not good for the body. So kind of make it simple. You want to eat like the rainbow, kind of like this picture, because that's what nature intended, for us. All these things have colors for a reason. All these different colors inside of fruits and vegetables have phytonutrients, antioxidants that fights off free radicals. It prevents aging. It provides lots of vitamins and minerals for the body. So when people don't know what to eat, I just say shop on the outside of the supermarket, buy different colors of fruits and vegetables each season, and just rotate different things, and eat everything in moderation. Don't excessively eat one thing all the time. You want to rotate your veggies, your fruits, your grains and your meats. And don't eat the same thing every day. I think some of us, it's a force of habit. When you eat something you like, you tend to eat it every day. But it's good to kind of rotate different things. And also a good idea to learn to cook for yourself, because when you cook for yourself, you learn how to buy and shop groceries for yourself, and you make good foods for yourself with good ingredients. And lastly, it's not part of the 4 pillars of health, but it's also very important for everyone to have a good support system socially with friends and family. And especially if you have a career that you love, that you enjoy, and also have hobbies that you do on a regular basis, because all these things give you a sense of purpose. And when you have a sense of purpose, your well-being automatically improves. So some take-home points today. First, you want to reduce your stress on a daily basis. So every day, take some time, dedicate 15 minutes to decrease your stress through meditation, qigong, taking a bath, whatever you enjoy just to relax for the day. And that in turn will help you sleep better, and make sure you're sleeping every day around the same time, getting 7 to 9 hours of sleep. Also, eating well, your nutrition is very important because when you want your body to heal itself, you have to provide it with good ingredients, and you can do that through nutrition. And then last, we talked about exercise. So not exercises are always good for everyone. So you want to do exercise that's good for your body. So everything in life is about balance based on Chinese medicine point of view. Do everything in moderation. You don't want to overdo or underdo anything. And the take-home point is really just relax, relax, relax. So most of us are also stressed out lately. Relaxation is key to help rebalance the body. I was going to review some acupressure points with everybody, but I think we might be running a little low on time. So I will skip this, but I did email a PDF file to Monique about some self-care tips and tools that you can use, some links to Qigong exercises and different things. So if you're interested, Monique will provide her email on the chat box. So you can email her, and she'll email you a copy of the PDF file.